70-year-old Garry experienced a stroke while driving near Nowra in New South Wales. A highly skilled paramedic team from New South Wales Ambulance, trained to use advanced stroke-smart telehealth as part of a clinical research trial, were on the scene within minutes. They didn't know at the time, but the team's extraordinary response to Garry's stroke set a record for southwestern Sydney. Stroke-smart paramedics are helping to dramatically improve the way urgent care is delivered. The trial aims to provide the patient with the right care at the right time and right place as quickly as possible.
We're transforming the chain of survival using technology that puts the patient at the centre and paramedics at the front. Together, we're accelerating the patient's journey, enhancing their access to advanced stroke treatment.
Traditional care wouldn't involve the neurologist until the ambulance delivered a patient to the emergency department. But thanks to a pilot using advanced telehealth, while the patient was travelling up the highway, Mark was able to determine that Garry was experiencing a serious stroke, with their diagnostic tool indicating a catastrophic score.
Garry's score was quite bad, it was quite high, so he had a score of a 14. And typically, if they're not treated quickly, their chances of a good outcome are very, very low.
Based on this, Mark was able to direct the crew to bypass 2 closer hospitals and head straight to a specialist stroke centre. It was a big decision to make. Normally, a 160-kilometre drive from Nowra to Liverpool Hospital would take 2 hours.
By making that decision to bypass, we actually got Garry to Liverpool Hospital much more quickly than if he'd stopped off at one of those other hospitals.
While Mark and the paramedic monitored Garry as the ambulance travelled, the telestroke tool allowed the neurology registrar at Liverpool to watch Garry's status as he travelled up the highway, cleared the way for Garry to go straight to the waiting CT scanner on arrival, gave faster access to the primed endovascular clot removal team, and fast-tracked thrombolysis when the clot was too deeply embedded for thrombectomy.
He was treated with clot-dissolving medicine within 90 minutes of his stroke onset, which is incredibly rare for rural patients in Australia. Our team met Garry at the door, took him straight to CT, did the CT, called me, we had a look at the scans, and we decided to treat straight away. So Garry was treated in 31 minutes door-to-needle time, which is actually a record for Liverpool Hospital. The fact that he recovered so dramatically is almost miraculous.
My arms started to move. I could, when they said lift them up, I could lift them up, the same as my legs, virtually in a matter of no time at all. I'm great now. The specialist told me that I have to lose a bit of weight, which I knew anyway. But I've been great. I've been able to talk. I haven't had any physical problem at all.
Pre-hospital stroke telehealth allows unprecedented teamwork between paramedic and neurologist, less likelihood of a time-consuming inter-hospital transfer, a faster response from the ED and stroke team due to real-time updates, lives to be saved, and disability reduced, and decades of savings in millions of dollars of disability payments.
As a stroke smart paramedic, I'm able to provide extremely important data to the teleneurologist, and together we're fast tracking the patient, getting them to urgent stroke treatment. It's a game changer, and I feel as though I am making a significant contribution to the patient's outcomes.
Together, we are changing the way pre-hospital stroke care happens. This is just the beginning. Thanks to Garry Tierney and Kim Cooper for sharing your story. To join these clinical trials, contact the Australian Stroke Alliance.